Okay, good afternoon, dear students. We are again gathered here for the another session via virtual means. It is a sunny day outside today, and still we are having a solitary life. If I have to talk about myself, it has been continuously 7 days. I'm not being going outside because in Chandragiri municipality there is not only the lockdown, there is a curfew too. We cannot move outside. There are lots of cases being prevalent. The antigen test and the PCR test was positive above the normal, so they normally decided to give an order for a curfew. So we have been here enjoying the solitary life, I have to say. And we have started the safe motherhood, and it was Shreyana Adhikari who has been materializing the things perfectly. She started the general introduction of the safe motherhood in our last class, and she also went with the risky factors. What are the conditions under which, if the pregnancy is carried out, the scenario will be risky? She discussed, she elaborated the things, and I guess we'll be going ahead today. Most probably, I don't know, but most probably we'll be talking about the problems of the pregnancy. What are the major and the minor problems we do normally get in the pregnancy? We'll be talking up on this topic. Yes, Shreyana, she will be talking today in this topic too. So without any delay, I would like to request Shreyana. I guess I have to permit the sharing of the slide first. Uh, okay, Shreyana, you can check if you can share the screen or not. If you can share the screen, you can start the discussion.
Yes, sir, I can share the screen. Okay, I will start.
Okay.
Welcome to my presentation. So today we will be discussing about contents for day 2. Major and minor problems of pregnancy, maternal and child health care and its measures, safe delivery and natal care of postnatal mother. Minor problems of pregnancy. A. Nausea and vomiting. Nausea and vomiting are two different terms. Nausea means a feeling of sickness with an inclination to vomit, whereas vomiting means ejecting the matter from the stomach through the mouth. The exact cause of morning sickness, nausea or vomiting is unknown, but it's likely due to hormonal changes that wreak havoc on our body. It's estimated that morning sickness occurs in up to 80% of all pregnancies, with nausea and vomiting starting around week 6. It is a mild, self limited condition that can be controlled with conservative measures and has no adverse effect on the fetus. Medical professionals prescribe anti nausea medications. Proper nutrition and daily exercises and medication can help with nausea and vomiting. Anemia. Anemia is a decrease in the total amount of red blood cells, RBCs, or hemoglobin in the blood, or a lowered ability of the blood to carry oxygen. When anemia comes on slowly, the symptoms are often vague and may include feeling tired, weakness, shortness of breath, and a poor ability to exercise. During pregnancy, the volume of blood increases. This means more iron and vitamins are needed to make more red blood cells. If a pregnant woman doesn't have enough iron, it can cause anemia. It is not considered abnormal unless your red blood cell count falls too low. This is iron deficiency anemia during pregnancy. During pregnancy, the baby uses red blood cells for growth and development. Especially in the last 3 months of pregnancy, if a woman has extra red blood cells stored in her bone, bone marrow before she gets pregnant, her body can use those stores during pregnancy. Women who don't have enough iron stores can get iron deficiency anemia. This is the most common type of anemia in pregnancy. Good nutrition before getting pregnant is important to help build up these stores. Anemia during pregnancy can also be caused due to vitamin B12 and folate deficiency. C is gingivitis, swelling of gums. Gingivitis means inflammation of the gums or gingiva. It commonly occurs because a film of plague or bacteria accumulates on the teeth. Gingivitis is a non destructive type of periodontal disease, but untreated gingivitis can progress to periodontitis. This is more serious and can even lead to loss of teeth. Some women get swollen and sore gums, which may bleed during pregnancy. Bleeding gums are caused by a buildup of plaque on the teeth. Hormonal changes during pregnancy can cause gums can cause gums more can make gums more vulnerable to plague, leading to inflammation and bleeding. Between 60% and 70% of women experience gingivitis while pregnant. Using anti-gingivitis toothpaste can help with the gingivitis during pregnancy. D is piles or hemorrhoids. Hemorrhoids are swollen veins in the lowest part of the rectum and anus. Sometimes the wall of these blood of pregnant women develop hemorrhoids. Hemorrhoids are common during the third trimester. Hemorrhoids during pregnancy may lead to gradually resolve by themselves after delivery. A woman is more likely to get hemorrhoids if she is constipated because straining to have a bowel movement swells the veins. The growing baby also puts pressure on the large veins behind the uterus. Hyperacidity. Hyperacidity, also known as acidyspepsia, is a medical disorder when the stomach produces an excess of acids, mainly hydrochloric bigastric glands. Hyperacidity during pregnancy can be reduced and controlled by mindful eating habits and eating a well balanced and nutritious diet. Regular meal patterns and timings, avoiding the intake of spicy, sour, deep fried, and junk foods, restricting the intake of caffeinated beverages, and quitting smoking and limiting alcohol consumption. Hyperacidity is a common pregnancy occurrence. Pregnancy hormones can make the valve at the entrance to the stomach relax so that it doesn't close as it should, which causes hyperacidity in most pregnant women. Note: chest pain, backache, constipation, tiredness, numbness in feet, muscle cramps, and itching in the body are also other minor problems of pregnancy. Major problems of pregnancy: abortion. Abortion, the expulsion of a fetus from the uterus before it has reached the stage of viability of viability in human beings, usually about 20th week of gestation. An abortion may occur spontaneously, in which case it is also called miscarriage, or it may be brought on purposefully, which in case it is often called an induced abortion. Discussion of spontaneous abortion. Miscarriage, also known in medical term as spontaneous abortion and pregnancy loss, is the natural loss of an embryo or fetus before it is able to survive independently. Some use the cutoff of 20 weeks of gestation, after which fetal death is known as a stillbirth. The most common symptom of a miscarriage is vaginal bleeding with or without pain. Sadness, anxiety, and guilt may occur afterwards. Spontaneous abortions or miscarriages occur for many reasons, including disease, trauma, genetic defect, or biochemical incompatibility of mother and fetus. Occasionally, a fetus dies in the uterus but fails to be expelled, a condition termed as missed abortion. The underlying cause in about half of cases involves chromosomal abnormalities. Diagnosis of a miscarriage may involve checking to see if the cervix is open or closed, testing blood levels of human cryo- chorionic gonadotropin (HCG) and an ultrasound. Other conditions that can produce similar symptoms include an ectopic pregnancy and implantation bleeding. Prevention is occasionally possible with good prenatal care. Discussion on induced abortion. Approximately 205 million pregnancies occur each year worldwide. Over a third are unintended, and about a fifth end in induced abortion. Most abortions result in unintended pregnancies. Induced abortion may be performed for reasons that fall into four general categories: to preserve the life or physical or mental well being of the mother, to prevent the completion of a pregnancy that has resulted from rape or incest, to prevent the birth of a child with serious deformity, mental deficiency, or genetic abnormality, or to prevent a birth for social or economic reason, such as the extreme youth of the pregnant female or the sorely strained sources of the family unit. Whereas in Nepal, induced abortions are also conducted when a couple desires son rather than daughters. By some definitions, abortions that are performed to preserve the well-being of the female or in case of rape or incest are therapeutic or justifiable abortions. At present, there is provision of legal abortion in our country in certain conditions. According to this provision, Abortion Act 2058 BS, women can abort their pregnancy before 12 weeks. At present, safe abortion service is being provided by Maternity Hospital, Thapathali, Kathmandu, Marie Stopes clinics of different districts, and family planning clinics. B is toxemia. Preeclampsia, toxemia, is a serious problem that causes high blood pressure and releasing of extra protein in the urine, including the concentration of toxic substances in the blood. It can develop anytime during the second half of the pregnancy, even during labor or up to 6 weeks after delivery. Preeclampsia can lead to eclampsia, a serious condition that can have health risks for mom and baby, and in rare cases cause death. If your preeclampsia leads to seizures, you have eclampsia. Symptoms of toxemia: excess protein in your urine, proteinuria, or additional signs of kidney problems, severe headaches, changes in visions, including temporary loss of vision, blurred vision, or even light sensitivity, upper abdominal pain, usually under your ribs on the right side, nausea or vomiting, decreased urine output, decreased level of platelets in your blood, thrombocytopenia, impaired liver function, shortness of breath caused by fluids in your lungs. C is ectopic pregnancy. Ectopic pregnancy, also called extrauterine pregnancy, is when a fertilized egg grows outside a woman's uterus. It can cause life threatening bleeding and needs medical care right away. In more than 90% of cases, the egg implants in a fallopian tube. This is called a tubal pregnancy. An ectopic pregnancy happens within the first few weeks of pregnancy. An ectopic pregnancy can cause the fallopian tube to burst or rupture. Emergency symptoms include major pain with or without severe bleeding. The following are the known causes of ectopic pregnancy: inflammation and scarring of the fallopian tubes from a previous medical condition, infection or surgery, hormonal factors, genetic abnormalities, birth defects, medical conditions that affect the shape and condition of the fallopian tubes, and reproductive organs. Improper use of IUD, intrauterine device, which is a birth controlling method, and endometrial tumors are considered as the main reasons of ectopic pregnancy. D is hypertension. High blood pressure or hypertension is a common condition in which the long term force of the blood against your artery walls is high enough that it may eventually cause health problems, such as heart disease. The more blood your heart pumps and the narrower your artery, the more blood your heart pumps, the narrower your arteries, the higher your blood pressure. Monitoring the blood pressure is an important part of prenatal care. Treatment is important. However, high blood pressure puts a pregnant woman at risk of heart attack, stroke, and other major complications. And it can be dangerous for the baby. If certain medication is needed to control the blood pressure during pregnancy, the healthcare provider will prescribe the safest medication at the most appropriate dose. Next slide shows the reasons why hypertension is dangerous during pregnancy. Decreased blood in the placenta. If the placenta doesn't get enough blood, your baby might receive less oxygen and fewer nutrients. This can lead to slow growth, intrauterine growth restriction, low birth weight, or premature birth. Prematurity can lead to breathing problems, increased risk of infection, and other complications for the baby. Placental abruption. Pre- Preeclampsia increases your risk of this condition, in which the placenta separates from the inner wall of your uterus before delivery. Severe abruption can cause heavy bleeding, which can be life threatening for you and your baby. Intrauterine growth restriction. Hypertension might result in slowed or decreased growth of your baby. Intrauterine growth restriction. Injury to your other organs. Poorly controlled hypertension can result in injury to your brain, heart, lungs, kidneys, liver, and other major organs. In severe cases, it can be life threatening. Premature delivery. Sometimes an early delivery is needed to prevent potentially life threatening complications when you have high blood pressure during pregnancy. Future cardiovascular disease. Having preeclampsia might increase your risk of future heart and blood vessel cardiovascular disease. Your risk of future cardiovascular disease is higher if you've had preeclampsia more than once, or you've had a premature birth due to having high blood pressure during pregnancy. E is Rh incompatibility. When a woman and her unborn baby carry different rhesus Rh protein factors, their condition is called Rh incompatibility. It occurs when a woman is Rh negative and her baby is Rh positive. The Rh factor is a specific protein found on the surface of a woman's body. If a woman is Rh negative and her baby is Rh positive, her body will react to the baby's blood as a foreign substance. In this condition, the Rh antibodies may cross the placenta and attack the baby's red blood cells. This can lead to hemolytic anemia in the growing fetus. Hemolytic anemia is a condition in which red blood cells are destroyed faster than the body can replace them. As a result, severe anemia, brain damage, or even death occurs in the fetus. If a woman is Rh negative and her partner is also Rh negative, they don't have anything to worry about. But if her partner is Rh positive and she is Rh negative, the doctor will look for the signs of Rh incompatibility. The firstborn child of the couple is safe, but if the couple tries to conceive another child, it can cause problems. Treatment of Rh incompatibility. In today's modern world, Rh incompatibility can be treated where the treatment focuses on preventing the effects of the incompatibility. In mild cases, the baby can be treated after the birth with a series of blood transfusions, hydrating fluids, electrolytes, which are the elements that regulate metabolism, and phototherapy. Maternal and child healthcare and its measures. Maternal and child health (MCH) care is the health service provided to women in their childbearing age and children. It is very important during pregnancy, postnatal, and puerperium for mother and children below the age of 5. The concern towards MCH care got proper concern after the World Summit for Children on 29th to 30th September 1990 at the United States. The main concern of MCH care is to reduce the volume of maternal and child mortality. Around 810 women die every day from preventable causes related to pregnancy and childbirth, and 94% of all maternal deaths occur in low and middle income countries like Nepal, Pakistan, and Bangladesh. In Nepal, about 12,000 children are dying by gastrointestinal diseases every year. Similarly, maternal mortality is still 239. Challenges and way forward of MCH care in Nepal. Challenges: maternal and child mortality, which can be solved if we increase health facilities. Lack of awareness can be resolved by education. Poverty can be overcome by employment. Lack of health personnel, we can solve it if we produce them. Weak woman status can be reduced if we uplift women in the society. Weak government policy can be solved by strong and stable government policy. Importance of maternal and child health care. MCH care is essential to have safe pregnancy. It helps to prevent the different complications during antenatal, natal, and postnatal period. It provides knowledge and skill to protect and promote the health status of mother and newly born baby. With the assistance of skilled birth attendants, we can protect the health of the mother and child. Special attention on immunization, balanced diet, maintenance of hygiene during pregnancy increase the chance of birth of the healthy baby. It promotes the status of reproductive health. It protects the woman from high risk pregnancies and unsafe abortion. Maternal child health care. A. Care of pregnant woman or prenatal care. Prenatal care is when a pregnant woman gets checkups from a doctor, nurse, or midwife throughout her pregnancy. It helps to keep her and her future baby healthy. One is personal hygiene. Personal hygiene helps to protect pregnant and breastfeeding women from diarrhea, cholera, typhoid, jaundice, dysentery, worm infestation, etc. Moreover, kitchen, living room, courtyard, and surrounding around a pregnant woman should be clean. A pregnant woman should bath regularly, clean their genitals well, and wear clean and comfortable clothes. Two is nutritious food. The healthy foods help build the skin, brain, and tissues of the child, and folate may help prevent neural tube defects, developmental abnormalities of the brain and spine, such as spina bifida. A pregnant mother must take adequate food, which are rich in carbohydrate, fats, protein, irons, calcium, iodine, etc. A balanced diet will also reduce the risk of anemia as well as other unpleasant pregnancy symptoms such as fatigue and morning sickness. Daily exercise and rest. Regular exercise during pregnancy can improve your posture and decrease some common discomforts such as backaches and fatigue. There is evidence that physical activity may prevent gestational diabetes that develops during pregnancy, relieve stress, and build more stamina needed for labor and delivery. Vaccine and immunization. Maternal immunization protects both the mother and fetus from the morbidity of certain infections. It can also provide the infant passive protection against vaccine preventable infection acquired independently after birth. Use of medicine. The intake of drugs without the recommendation of the doctor can adversely affect health of the mother. Similarly, it may also hamper the health and development process of the fetus. Hence, only prescribed medicine should be taken by a pregnant woman. Safe delivery and natal care. Childbirth, also known as labor or delivery, is the ending of pregnancy where one or more babies leave the uterus by passing through the vagina or cesarean section. The whole process of labor can be divided into three phases. Normally, the total process of labor lasts for 8 to 24 hours. The duration of labor depends upon various factors like birth parity, physical strength, structure of pelvic bone, height and weight of pregnant mother. Phases of labor. The first stage is dilation. Before labor starts, your cervix is long and firm. During the first hour of labor, the muscle of the uterus, womb, contracts and helps shorten and soften the cervix so that it can dilate or open. For first time mothers, this stage can last from 6 to 36 hours. During this time, the pregnant woman might experience contractions. Some can be quite mild, like a period pain. Others can be sharp and strong. Initially, the contractions will be short, between 30 to 40 seconds, and irregular. Once contractions are 5 minutes apart and a minute or more in length, labor is said to be established. A show. The discharge of a plug of mucus that can be thick and stringy or blood tinged. This may happen the day you go into labor or up to a week before. Breaking of the water. This means that the amniotic sac around the baby has ruptured. Things to do and try at hospital when dilating. Try not to tense up contractions. Your body is trying to release something, not tighten up. The find position that feel comfortable, walk the corridor slowly, lean on the walls, use the Swiss ball and lazy boy chairs. Try to stay off the bed unless for a short rest. Water is great for relaxation and coping with contractions. If you don't have, use a pool, try the shower. Bring music and player if it relaxes or calms you. Bring an electric oil burner and use the aromatherapy oil. Continue to take refreshments and drink small amounts of water frequently. Phone calls are a distraction from the task of giving birth and looking after the new baby. Encourage family and friends to phone one designated person for updates. Stage 2 is expulsion. This is from the time of full dilation of the cervix until the baby is delivered. During this stage, there are two phases. One, the initial part is a passive, descent phase where the baby's head moves down through the mother's vagina. Second is this is followed by an active phase where the mother feels the desire to push. This urge to push is usually less strong if the woman has an epidural. The pushing involves contracting the abdominal muscles in time with each uterine contraction. Pushing usually comes instinctively, so there is no need to worry about not knowing how to push. However, it is important to push in time with uterine contractions to maximize efficiency and minimize fatigue. In a woman who has had children previously, this active pushing phase takes on average 20 minutes. In a woman who is having her first baby, this active phase takes an average of 40 minutes. Here are ways to take care of a mother during delivery or the second phase of labor. All women during labor and delivery need individual, individual institutionalized care. Pregnant women should be encouraged to seek support from a skilled birth attendant. Provide physical and psychological support to the woman in labor and trusted support person who is with her. Assist her to adopt different position, try different breathing patterns, be massaged on the back and make low sounds during labor as this helps her to relieve pain and manage the contractions. Encourage her to take 1 cup of fluid at least every hour and assist her to empty her bladder at least once every 2 hours. Keep her informed about the progress of her labor so she remains relaxed and confident. Monitor fetal condition by checking the fetal heartbeat every 30 minutes. It should be within the normal range. Monitor maternal condition by measuring her blood pressure and temperature every 4 hours and her pulse rate every 30 minutes. Assess the progress of labor by checking uterine contractions, length, strength, and frequency every 30 minutes, descent of the head every 2 hours, and cervical dilation every 4 hours. Prepare the equipment you need for the birth, including protective clothing for yourself, scrub or sterilize everything that will come into contact with the tissue or bodily fluids. Hand washing with soap and clean water is the most important way to reduce the risk of infection being